Hi, good evening, everyone. How are you guys? Am I audible? Can someone write and confirm? Okay, wait. Someone from my team can open the mics for everyone, please. Okay, one sec. Okay, fine. I think we can allow the participants to unmute. Okay. Yes, so you guys can unmute and yeah, but only one request, do not disturb in between. We can talk. Okay. Guys, so thank you for joining. There are a lot of people in YouTube as well. There are, I think, now 45, 47, 50 people are in YouTube as well. So let's wait for a couple of minutes or 2 minutes, and then we can, start. So by the time, let me ask you one question. How many of you are aware of that, pharmacy people or PharmDs especially are eligible to go to ICMR? Okay, how many of you have that knowledge? And if yes, then on which positions do you think they can go and they can start their career with ICMR? Yes, guys, please tell me. So by the time people will join, we can discuss this. All the people from YouTube and here in Zoom link, everyone. What do you think, guys? Medical writing, Nilima Borkar, medical writing in ICMR. Okay. Do you know what is ICMR, guys, anyways? Okay, scientist B. So with yes, scientist B. Yes, definitely. Research scientist. Okay. Yes. So ICMR is Indian Council of Medical Research. Medical research. Okay. Yes, medical research. What else? Scientist B. Research assistant, research coordinator. Absolutely yes. Yes, true. What else? When everyone is joined, like we will start at 7:05 sharp 19:05. Okay, so let's discuss for 2 more minutes. Yes, Indian Council of Medical Research, scientist B. Yes. Yes. Perfect. Anything else you want to say? That research associate can be joined there at ICMR? Yes, absolutely. Okay. Clinical pharmacist in ICMR. Oh, guys, no. ICMR is not a pharmacy or hospital. Okay. You cannot join as a clinical pharmacist in ICMR for sure. I'll be taking all the questions. Keep your questions in mind, and you can otherwise drop your questions in, now in the chat box also. I'll be definitely taking in between and, after the webinar. So I can see there are 100 people, around 78 people I can see live right now on YouTube, and 32 in our Zoom. So I think let's start. It's more than 100. So let's start. Let's not wait much. Let me share my slides first, and in between you can get your questions on board. You can type your questions here, or you can stop me in between and ask your questions. Subhansi Gupta is writing research coordinator, clinical operations, clinical trials, clinical data scientist, clinical data analyst. Yes. Okay. So let me share my screen, and please let me know if it is visible. Yes, guys. Is it visible? My screen, can someone tell me, is it visible? Okay, let me make it full screen. Yeah, perfect. Okay, thank you everyone, thank you. Yeah, so let's start. So guys, first of all, I would like to thank you all and everyone who is joining here, this webinar. And I would introduce myself to you. I'm Dr. Ajit Singh. I'm the CEO and founder of CleanMed Research Solutions. I'll give you the introduction of CleanMed later. It's not mandatory right now because our focus must be on the career opportunities and eligibilities for families. So I'm Dr. Ajit Singh, as I told you, and I founded CleanMed. Along with CleanMed, I am working as scientist C right now for ICMR. So everything is, like a tenure based in ICMR. No job is 100% permanent right now. Okay, so they take at the contracts. So my contract is for 3 years. That is going to end soon anyways, because I have completed 2.5 years in ICMR right now. I have joined as Research Associate 3. When I joined ICMR, I joined as Research Associate 3. Okay. And in a tenure of 8 months only, I got promoted to Scientist C as per my qualifications and as per my experiences. I'll be telling you like at what stage, what kind of experience you all need. Okay, you'll be getting the glimpse of experiences, you'll be getting the glimpse of salaries, you will be getting the glimpse of educational qualification. So after post-baccalaureate, I did my PhD in cardiology from Kasturba Medical College. And when I was in post-baccalaureate, that time I have finished at least 6 papers publications, including case reports. My first case report in British Medical Journal, and then original papers, multiple original papers. And by the end of my PhD in 2019, that was finished in 2019. I'm the post-baccalaureate of 2014 batch, pass out, and I have finished the PhD in 2019 from Kasturba Medical College, Manipal, in the medical college, 100%. And then I started CleanMed, and then I was called by ICMR itself, because I have done extensive work in heart failure in my PhD and after my PhD as well. We have done India's one of the largest heart failure registry till date, and I was the principal investigator for that registry. Okay, that is registered in NIH, National Institute of Health, USA, in clinicaltrial.gov, in Indian CTRI, this Clinical Trial Registry of India, and multiple ICMR, multiple places, DCGI and all, DCGI and all. Okay, so I had extensive experience, but still I have joined ICMR for Young Diabetic Registry as Research Associate 3 in 2021 March, and after 8 months I got promoted to Scientist C. And right now I'm working as Senior Scientist C for ICMR. My tenure is going to finish anyways in 2024 March, but that is extendable. Definitely they will extend it as the projects are getting extended. Multiple projects are there. So I'm heading right now, proudly I'm heading around 12 hospitals in Karnataka region, coastal Karnataka region, including Manipal. And if you have heard of multiple hospitals in Mangalore, AJ hospitals, and Yenopoya, and Father Muller, and Nitte, KS Agde, and KMC Mangalore, and multiple others. For the Young Diabetic Registry, for the Young Diabetic projects, I'm heading that. I'm the in charge of the entire collaborating center at Manipal, and all the hospitals are reporting centers for ICMR. So that's about me, and let's now come to the point, to today's webinar, the exclusive webinar. What I try to convey the things. Why I am conveying these things? Because recently I got almost 50 plus questions from different people, and they were sending only one document. In that document, I saw that they have written the eligibility for PharmDs for Scientist B or C. I'm not sure, but there were some positions, some opening in ICMR project, and that project was showing the eligibilities for PharmDs as well. And I don't know why people got surprised. See, I mean, it is obvious to get surprised because you people don't know like what exactly you are, what exactly you can do. Okay, so it is I mean, obvious to get surprised, but you have a lot of capabilities there, guys. Come on. As I'm telling, Indian Council of Medical Research. Medical research. Medical does not mean any kind of specific targeted audience or something. Medical means including all the medicines, okay, including all the medicines, procedures, treatment patterns, epidemiological studies, biomedical research, all the things, biotechnological research. I mean, though we have the DST, Department of Science and Technology, different. We have DBT, Department of Biotechnology, as separate wing of Government of India. But still, ICMR is the sole proprietor for all kind of medical research. All kind of medical research. I'll show you. I'll take you through the website as well. That is the one of the important tasks in today's webinar. I'll take you through all the aspects of website as well, ICMR website, and I will be showing you all the positions, qualifications, salaries, how you can enter into the ICMR, and all the opportunities I'll show you today. Right, guys? So let's start today's exclusive webinar on career opportunities and eligibility of PharmDs and other pharmacy professionals in the Indian Council of Medical Research, ICMR. So let's start with the introduction to ICMR. So ICMR, as I told you, is the Indian Council of Medical Research. Okay, Indian Council of Medical Research, and they cover a vast, they have the vast scope of research in biomedical, medical field, epidemiology, and a lot of things. I'll show you those things. Okay. So the mandate of ICMR, first thing you have to understand what is the mandate of ICMR, then you can correlate with yourself. So the mandate of ICMR is, that is the apex body. Apex means the superior body in India for formulation, coordination, and promotion of biomedical research. When it comes about bio, it includes all kind of environmental research, biotechnology, marine science, or whatever you say. Okay, agricultural, everything. Everything means everything. All biomedical research. Okay, so formulation, coordination, and promotion of all kind of biomedical research. Food industry, everything. Okay, population science, everything, public health, everything is included in ICMR. It conducts, coordinate, and implement the medical research for the benefit of society. This is the policy maker in India. ICMR is one of the policy maker in India, translating medical innovations into products, processing, and introducing them into the public health system. So this is the mandate of ICMR. Let's go to understand more about ICMR. Vision is translating research into the action for improving the health of the population. Okay, and mission, generate, manage, and disseminate the new knowledge, increase focus on research on the health problems of the vulnerable, the disadvantages, and the marginalized sections of the society. It includes everyone. Harness and encourage the use of modern biology tools in addressing the health concerns of the country. Encourage innovations and translation research to diagnostics, treatments, methods, vaccines for prevention. Everywhere you fit in the scenario, everywhere. Okay, you fit in the research, you fit in the new knowledge, you fit in the innovation and translation of the research, you fit into the diagnostics, treatment, methods of vaccines, prevention, everything. Okay, and inculcate a culture of research in academia, especially medical college and other health research institutes, by strengthening infrastructure and human resources. That's about the ICMR. Okay, that's about the ICMR. So everywhere you fit. Now I'll come to the main point. What why I say I showed you this PPT, mission and vision of ICMR, but because ICMR is not just limited to the medical, what you think, MD, MBBS and other things, not at all. ICMR means all biomedical science, including all biomedical sciences, physiotherapy, occupational therapy, marine science, or whatever you think can be in the biosystem, it is there in the ICMR. Okay. Now I'll come to the main scenario. What are the job hierarchies in ICMR? Okay. Here you will see all the job hierarchies, and we will try to understand one by one their job aspects, their salary aspects, their qualification, their experience, and who can join, how can join. Okay, who can join and how can join. So it starts with the very basic term, that is technical staff or technical assistant. Okay, what do you understand by technical assistant, guys? Can someone give me a glance of technical assistant or technical staff? Anyone from YouTube or from Zoom link, anyone can say, what is the technical staff or assistant in ICMR? Tell me, guys. Medical coders? Yes, could be, definitely. What else? Medical analyst, data entry operators, understand? Data collectors, okay, data collecting people, data entry operators, medical coders, data managers, data analyst, everything. No, pharmacovigilance is not in ICMR. Usually that is taken care by IPC, Indian Pharmacopoeia Commission, under the umbrella of DCGI. Okay, pharmacovigilance does not come under ICMR. Pharmacovigilance comes under IPC, Indian Pharmacopoeia Commission, under the umbrella of DCGI, Drug Controller General of India. Okay, Drug Controller General of India. So pharmacovigilance comes under IPC, not under ICMR. Okay, but ICMR takes care of the side effects as well, and reporting goes to pharmacovigilance department of PVPI, that is Pharmacovigilance Program of India, to the IPC under DCGI. Okay, but definitely when there are clinical trials, conducting clinical trials and all, there are side effects and all, documentation is there in ICMR, but that always goes to PVPI also along with that. Okay, I'll tell you what would be the work. What would be the work? I'll tell you everything, Subhansi. Yes, so yes. Guys, I'm coming to that. Stefani is asking, can PharmD freshers join ICMR? Definitely can join. I'm coming to that. Okay, so first thing is technical staff or assistant. As I told you, that could be data analyst, data coder, data entry operators, data collectors, or at the basic level. And then it comes to research assistants. Okay, research assistants or clinical research assistants, CRCs we call them, clinical research coordinators. Okay, and research assistant and research associates. The second level is research assistant and associates. In that also you have to understand, guys, in research assistant and associates, there are multiple levels. The first level is clinical research coordinator. Then it goes with clinical research assistant, research assistant 1, research assistant 2, that is usually JRF level, and then research assistant 3, research associate 3, okay, that is SRF level. So CRC, clinical research coordinator, then research assistant, and research assistant or research associate 1 and 2 are usually JRF positions. Okay, these are actually JRF positions. When we go to NET, NET, or when we go to other domains like to join the PhDs and all, that level changes. Okay, that label changes from research assistant or research associate 1st or 2, research associate 1 or 2 to this JRF, junior research fellow or senior research fellow. Then it comes to the scientists. Okay, from research assistant, research associate, it comes to scientists. So in research assistant, again CRC, then research assistant, research assistant or CRC are same, and then research associate 1, 2, 3. Okay, so research associate 1, 2, and research assistants are usually JRF, and research associate 3 is usually SRF, senior research fellow. Okay, that is usually PhD level and all. Okay, then it comes to scientist B. Okay, then it comes to scientist B, right? And then scientist C, scientist D, scientist E, then F, G, H. Okay, those are administrative level. Scientist E to H are administration. Okay, policy makers. Okay, till scientist D, these all are kind of project managers or coordinating center in charges, or the project in charges. I mean, at the wide level, national level. Okay, from the scientist C, D, I mean from the D and E, these are national level positions. Scientist C and B are project level positions. Okay, like institutional level positions, or we say like the multiple institutions, but one coordinating center or reporting centers. Okay, when it comes to scientist D, that is like the project manager, national level. Scientist G, scientist D and E. Okay, these are the people who make the policies, who make the clinical trials. Okay, and who make the policies to the government for tobacco cessation, for multiple clinical trials, for the public health and all, everything. Okay, these are the people. And then Director General, who holds the entire ICMR, right? So let's begin the game here. First is your technical staff and assistant. So for the technical staff or assistant, bachelor degree in the relevant field is the qualification. Minimum qualification is bachelor's degree in the relevant field, and the specific field of study may depend on the nature of technical work involved, such as life science. If the project is from life science, it could be life science. Your project is from biotechnology, you could be from the biotechnology. The specific demands are there based on the specific projects. If the project is from microbiology, people will be preferred from microbiology. If the person is the project is from biochemistry, then person is also needed from the biochemistry background, because they will have the knowledge of the subject, they will have the knowledge of the project, they will be understanding how to proceed with that, right? They will be understanding how to proceed with that. And pharmacy, there are a lot of things in pharmacy, pharmaceutical sciences, analytics, pharmacy practice, hospitals, clinicals, multiple things in pharmacy, pharmacognosy. Okay, herbal drugs, other drugs are there. So pharmacy is like a lot, right? Pharmacy is like a lot. And when it comes to pharmacy practice, when it comes to PHARMDs, PHARMDs means pharmacy practice, either it is MPharm pharmacy practice or PHARMDs, they all belong to the clinical side, they all belong to the medical side. Okay, when it comes to ICMR, this is like the, what we say, the wonderful scope for PHARMDs, because they are the people who have the best clinical knowledge. They are the people who have studied pharmacotherapeutics, who have studied pharmacology for multiple years, and who have the exclusive internship in the hospital, right? They know how to pursue the career. They know how to pursue the research if you have done that. Okay, so if you're telling that you are eligible or not, you are definitely eligible. You are definitely eligible for technical staff. You are eligible for scientist B. You are eligible for research assistant, research associate, everything. Till scientist B, you are applicable. You are even what we say, eligible for scientist C also. Okay, you are eligible for scientist D also, but with the certain experiences of the year. Okay, certain year of the experiences, you are eligible for scientist DE. If you think you are not eligible for scientist E, you are eligible for scientist E. MPharm pharmacy practice, MPharm pharmacology, PharmDs, you all are eligible for all the positions of ICMR, all the positions. But at different hierarchies, the level of experience and level of qualifications changes. Okay, so let's understand. The first level is technical staff. Okay, and the experience is technical staff or assistant, freshers can join. Definitely CRCs and all also, I'll come to that. But here technical staff and assistant, freshers can join. Okay, freshers can join this. And salaries, if I talk about salaries of technical staff and assistant, that is totally based on the 7th Central Pay Commission, 7th CPC. Okay, 7th CPC. And what's that? Guys, tell me, can you tell me what should be the salaries? I want you to expect the salaries for technical staff or assistant. Technical staff salaries, guys. Can someone expect the technical staff salaries? 50K per month, Abhishek. 20 to 22,000. Anyone else? 40 to 60,000, 30,000. Okay, so let's see. Technical staff or assistant usually get, I mean, it is based on the project. For sure, it is based on the project. But usually, as per the 7th Central Pay Commission, the technical staff or technical assistant people are getting more salary than research assistants. Okay, the more salaries than research assistants or research associates, technical staff, because why they are getting the more salaries?
Hey.
I think someone is speaking here. Okay, I think it's by mistake. So why technical staff is getting more salaries? Because they have specific skills of analytics, maybe because they are joining ICMR with certain skills. Data entry operators, data managers, data analytics, statisticians. Okay, so technical staff is exactly not the research assistant or research associates who are helping in the clinical trials or who are handling the sites or who are handling the data operations or anything. Technical staff has the technical skills, specific skills. Okay, guys, specific skills. That's why their salary is quite higher than the CRCs and CRAs. Understand, their salaries are quite higher than CRAs and CRCs. So it starts from usually 35,400, depending, again, it depends on the position, depends on the project, depends on the employee's experience. Okay, exclusively, it depends on your experience, your level of position, and your project. Usually, it is from 35,400 to 1,12,400. The range, can you see the range of the salary of technical staff and assistant, right? So this is the first stage. Now let's go to the second stage, and then second stage is research assistant or associates. The salary, if you look out, okay, wait, I think I need some changes in my slides. Wait, guys. Okay, by the time you can tell me some questions, you can ask me some questions by the time, guys. Okay, I'll just need 1 minute to make changes in my slides. Okay, by the time you guys suit up your questions, if you have right now, you can ask me, you can write your questions, guys. Just because I think I forgot to animate the salaries, that's why I need a minute to animate the salaries in all the slides. Okay, done. I'm done, guys, I'm done. Okay, so let's share the screen again. Okay, so I hope slides are visible again. I hope slides are visible again, guys. Can someone confirm? Okay, great. Thank you. I'll tell you the tenures, and I'll talk about the ICMR procedure also, and I'll be talking about the site also. I'll show you where to see the jobs, how to apply for the ICMR jobs. Okay, I'll tell you everything, don't worry. If you are staying back here, I'll be telling you everything. So second thing is research assistant or research associates. The qualification again is bachelor's degree. Okay, the specific field of study may vary based on the nature of the research project, as I told you. Again, it includes life science, biotechnology, microbiology, all relevant related disciplines. But some positions of research assistant and associates may require the master's degree or a higher level of education, like research associate 2 or 3. In the research associate 2 or 3, you may require master's degree or higher level of education like PhDs or postgraduate diplomas, sometimes in clinical research or some other domain. Okay, and hands-on trainings or on some other domains. Okay, that is required on the higher level, like some positions like research associate 3 or senior research fellow if you are applying for, or research associate 3 or 2, right? You may need master's degree. Now when it comes to PharmDs, PharmDs are perfectly eligible because they are equivalent to master's degree. They are equivalent to M.Pharmacy. Okay, this is doctoral degree definitely, but they are equivalent to master's degree. They don't have to go for master's degree, so they are perfectly eligible for research assistant and research associate 1, 2, 3 all. And this position is open for the freshers as well. Okay, this position, research assistant, research associate 1, 2, 3, all SRF JRFs are open for PharmDs. But you may have, you are expected to have some kind of experience, and that experience is to have the knowledge and skills related to the research methodologies, data collection, data analysis, scientific literature review. Okay, and that's why I always suggest my students, I always suggest the PharmD students to do some research in internship or when they have the 6 months project, not just make the thesis, because you can make the thesis, you can submit it to the university or the college, you may fulfill your criteria, but when you are going to job and they are asking the questions related to methodologies, related to research methodologies, related to data collection, related to data analysis, related to biostatistics, related to the statistical analysis, test survival analysis, lot of questions, what you will answer? Because you don't know anything. You have become the teacher. I have seen many teachers, I have seen many people who have zero knowledge of biostatistics, who have zero knowledge about the methodologies, who have zero knowledge of, like, they don't know what is the difference between all the epidemiological trials. They don't know what is the difference between descriptive and analytical studies. So when you will learn PharmD or your masters or your things are the place where you have to learn the things. You are expected to have this basic knowledge. Okay, I always request, I always tell, I always suggest people go and have the knowledge. They do that project. Why they have included project in your 5th year? Why they have included the internship, where you can learn the research, where you can learn the type of methodologies, how to collect the data, how to analyze, what is the scientific literature review. Someone asks you how to search the literature. How will you search the literature? Google. If you say Google, they will throw you out from the interview at the first sign. Okay, so you should have the knowledge, and again, based on the specific project, you may require to have some laboratory techniques, data management, and research ethics. If you are B.Pharm or if you are M.Pharm in other domains, and the project is related to, it's not related to clinical or something where they have the specific demands of running some instruments or something, then you have to have the knowledge of laboratory techniques, data management, and research ethics as well. So it is always mandatory for all the PharmDs guys to have this knowledge, and to have, people don't understand, people don't listen to me frankly, but I always tell, ICH GCP guidelines training is mandatory for all PharmDs from the 5th year and 6th year itself. ICH GCP guidelines training is mandatory because that will tell you the actual research ethics, that will tell you about the latest guidelines. Okay, ICH E6R2 we were studying till date, but on 19th of this month, the last month, 19th May, we got, after 30 years, we got R3. We got the 3rd revision in E6 guidelines, ICH GCP E6 guidelines. We got the 3rd revision itself. Okay, so I always tell you to go for ICH GCP guidelines training. That is mandatory for you. Okay, that experience is needed. Experience does not mean that you need to have 1 or 2 years or 3 years of experience in the company or research or somewhere. Experience means you should have your own experience, what you have done in 5th year or in 6th year. Okay, that experience is needed if you want to apply for research assistant or associate. You should be brilliant in this. Okay, 7th pay scale for the salary again, and the salary is somewhere around 31,000 to 45,000 per month for research assistant, and somewhere around 45,000 to 1 lakh per month for research associate levels. Research associate 1 or SRFs, they can take they can start with 45,000, or in some projects that could be even 1 lakh. Okay, in the starting only, right? So these are the salaries for PharmDs or for M-Pharms or for any PharmD, any pharmacy professional who have, or any healthcare professional who have the relevant knowledge, who have the relevant degree, and who have the relevant experience. Okay, experience does not mean that you should have the experience in some ICMR or some company or somewhere, but experience in or during your education. Okay, that's about research assistant and associates. Now I'll come to, as people are asking about scientist B. Okay, so scientist B, definitely master's degree in the relevant field is required. Master's degree. So again, if it is a clinical project or if it is a medical subject or medical project, PharmDs are more what we say, PharmDs are eligible, and they are most efficient people to join the scientist, join as scientist B in ICMR. Okay, so definitely the specific field of study may vary based on the research area and requirements, and in certain cases for scientist B, they may require PhD. Okay, or they may require PhD, or PhD is preferred. If suppose you are going with your PharmD degree and somebody is coming with the PhD degree, PhD people are preferred to scientist B job. Okay, you are eligible, but why you will not get the job? Because PhDs are being preferred. Why they are being preferred? Because unwantedly, unintentionally, they did some research. They have the knowledge of research. They have published some paper. Okay, they have published some paper. So experience, relevant research experience is often preferred, particularly for higher level scientist B positions. Research publications are almost mandatory. Research publications are mandatory. Multiple research projects are mandatory. And if you are going for like some project is related to cardiology, some project is related to immunology, okay, you should have good experience in that subject. Okay, you should have good number of publications, 1 or 2 high impact publications at least in that subject. Your project must be related, your project at any level, your project must be related to those subjects. People come and ask, sir, why we are not eligible for that? Array, you should match the criteria with the project. You are eligible. By degree, your qualifications are matching the criteria, but your experience is not matching the criteria. You understand what I'm saying? Your qualifications are matching the criteria till scientist D or E. Okay, your qualifications being a master's degree, being a PharmD, your qualifications are 100% matching with scientist B, C, and D. But your experience, your knowledge is not clear cut. So you have to raise your knowledge. Okay, you have to get the experience. If you are working, get it published, get at least 1 or 2 good papers in your field, wherever you are interested. Okay, it's not like if you are in the cardiology, publish in the cardiology. If you are in the immunology or psychiatry or genetics, anywhere, wherever you are working, being an intern or in 5th year, wherever, get it published in the good impact factor journal and have a good experience of that subject. That is important. Okay, so research publications, project work, and experience in a research laboratory or academic institution can be advantageous. Understand? Can be advantageous. By qualification, you are eligible, but by experience, you may not match the criteria. So don't be disappointed. Wait for your criteria, wait for the projects which are matching your criteria. You will be definitely getting. Okay, so salary for scientist B, if you can see, for scientist B, salaries are from 56,100 to 1,77,500 per month, again depending on the level and position and employer's experience. Understand? High-fi salaries. Now I'll come to scientist C. So scientist C, you can see qualifications are exactly like scientist B, means master's degree, preferably PhDs. Experience, look at the experience, what kind of experience is needed here. If PharmDs tell me that they are eligible for scientist C, yes they are. You guys are definitely eligible for this. Definitely you are eligible for scientist C. But you need some experience in clinical trials. You need some experience in international clinical trials. You should have some additional skill, experience. Look at the experience for scientist C. Considerable research experience and a strong publication record. Can you get it? Strong publication record, at least 5 to 10 good impact factor publications. Good impact factor, not by money or not in the predatory journals. As I always again tell my people, my students, don't go for the predatory journals. When you are publishing, always publish your paper in Scopus indexed or Web of Science indexed. Not even, I don't even prefer PubMed now. PubMed is even, what we say, kind of, not maintaining that level. Always publish your paper in Scopus and Web of Science. I always tell everyone. So if you are doing that, you will be able to get into even scientist C. I'm telling you, if you are fresher, but having the good experience of clinical trials, good experience of publication, having five publications, at least 5 publications in Scopus indexed with the impact factor of cumulative impact factor of 5 or 10, you are eligible for scientist C as well. Okay, but how will you get it? You have to do some hard work during your PharmD, during your MPharm, during your masters, during your PhD. I'm working as scientist C right now because I have 40 publications, not only 40 indexed publications in Scopus or Web of Science, 40 indexed publications, and there are more than 5 papers published in more than 10 impact factor journals. People say, how I reached at this place? Because I have done the extensive work, guys. If you are, you are capable to do, yeah, guys, come on. You guys are capable to do that. Don't just waste your PharmD. Start working from the 5th year, 6th year. If you need guidance, come to me. Go to your faculties, go anywhere, find a good mentor and do the research. If you literally want to come out of that clinical pharmacist zone, everyone is teaching how to become the clinical pharmacist, good clinical pharmacist. Come out of that. You have hundreds of the opportunities. I told in last 3 hours exclusive webinar also, and today I'm coming up with this exclusive ICMR webinar because there are a lot of things for PharmDs and pharmacy professionals. Just don't stuck with the people who are just telling, who are dragging you to the like how to check perfectly the medication errors, how to go to this, how to report this, how to do this to become the clinical pharmacist or something. That is nonsense. Come to research. Literally, I'm telling you. Because as I told last time also, PharmD, being a clinical pharmacist, there is saturated job. There are no good jobs. Okay, so that is the experience. First experience is considerable research experience and a strong publication record. And then candidates are expected to demonstrate expertise and leadership in their specific research area. Expertise means you should have done at least 3 to 5 years of the work on that research area. See, I did not get scientist C after postbaccalaureate directly. I got scientist C because I did PhD in cardiology. I have conducted multiple international clinical trials with Novartis. I had a lot of funds, more than 3 CR funds and a lot of things. And I have conducted this clinical trial, being a principal investigator with the team of more than 25 people. So they need that expertise and leadership, so you can handle the entire clinical trial or the sites or the whatever they say, the collaborating centers and all. You should have all the knowledge, so you can become the scientist C, but with the certain experience in managing research projects, guiding research team main, and securing the research fundings can be advantageous. Got it? That's why. So if you say you are not eligible to become scientist C, you are eligible to become scientist C because you have that qualification. But along with that experience, you have to earn, guys, right? And you can become the scientist C also. Salary, as you can see, 67,700 to 2 lakh per month, 2,08,000 per month for scientist C. Can you imagine how wonderful salary is? It is more than IAS PCS. Literally, I'm telling you, IAS PCS, IAS salary is 47,500 as per the CPC, including all HRAs and all. I mean, excluding HRAs and all, definitely. But this salary, look at this salary in research, and you guys are eligible for this, right? So next, I'll come to scientist D. Scientist D, similar as scientist C means as scientist B, right? Experience candidates are expected to have a significant contribution to their research field. Significant research means definitely you should have at least 5-6 years of the experience after the PhD or after the PharmD, at least after PharmD at least 10 years of experience. 8 to 10 years of experience is mandatory for scientist D. Okay, after PharmD at least 8 to 10 years of the experience in the research field as a leader, and you should have a significant contribution like 20 papers, 25 papers, indexed, good journals, everything. Experience in research, in managing the research projects, managing the research teams, and the collaborative research, multicentrics and all. If you have that experience, you will become the scientist D. And it's not like the PharmDs are not eligible. You are eligible. Okay. So seventh pay scale, 78,000 is the initial salary for scientist D, and it can go up to 2,09,200 per month. Got it, guys? For scientist D, this salary is for scientist D. Now I'll come to scientist E. Qualification again as scientist D, PhDs are preferable. PhDs are preferred to this job also, but masters also can be as scientist E. But experience here is quite high. At least 15 to 20 years of experience in the research. 15 to 20 years of the research experience, expected to have made significant contributions to the research field, demonstrated exceptional leadership like multicentric clinical trials as a head, project managers, have a proven track record in managing research projects, teams, and collaborations. Okay, that kind of experience you need for scientist E. Experience in securing the research grants funding is highly valued. Salary, 7th pay scale. If you look at the salary, the starting salary for scientist E is 1,18,500 to 2,14,100 rupees per month. That is the job hierarchy in ICMR. After that, so admin level. Okay, but special note and disclaimer here is these salary ranges are approximate and can vary based on the specific positions, grade, research area, and project funding, and pay scale determined by the government. Okay, it's always advisable to refer to the official ICMR notifications. They will show everything. As I got this recent ICMR advertisement, the salary is quite high, 100,000 salaries per month. There was 100,000 rupees per month. Okay, and PharmDs were eligible with certain research experience, definitely. Right, guys? So you should always check for all the eligibilities criterias, all the experience criterias, and notifications you must read completely. Okay, this is about the hierarchy. Now the next thing is how to get into ICMR. That is the important question. What I'm getting from everywhere, I got in the research, what we say, the registration Link also I got this question, how to get into the ICMR. So how a student can join ICMR. Okay, first thing is there are multiple pathways depending on their qualification. For like if you are M.Pharm, B.Pharm or PharmDs, mostly PharmDs are most eligible for ICMR literally. So you can join as ICMR research fellowship. Okay, ICMR offers several research fellowships and scholarship for the students at different academic levels. These includes the junior research fellowships and senior research fellowships for PhD scholars and junior research fellowships for medical and related science like pharmacy education. You can join direct as junior research fellow in ICMR. Okay, you can join as research associate, research assistant in ICMR, that is at the level of JRF. Okay, and you can join as SRF. You can join any short-term research fellowship also, that is eligible for all undergraduates and postgraduate students. ICMR research fellowships. Then recruitment for scientific positions. Scientific positions means research scientist, research associates, and research assistants. Okay, research scientists, research associates, research assistant can be directly you can join. So ICMR periodically announces vacancies for these all the positions. You can directly check in the ICMR website. Send your CV. There are multiple things, multiple modes, like they will call you for direct. Usually there are no written examinations. Okay, guys. Usually in ICMR, there is no written examination. For maximum of the positions, there is no written examination. Okay. In some high positions, you may have to face the written examination, or in some specific projects, okay, like tuberculosis, sometimes HIV or some other projects, you may face examination. Otherwise, there are no written examinations. You just have to go to the website, send your CV to particular email. They will directly call you to the interview. Interview might be, happening in rounds, 1 or 2 or 3 rounds. First round, the basic round, and then second round with the exclusively, with the project guides and all, and the third round with the ICMR employers, ICMR admins. Okay, so there could be 1, 2 or 3 rounds of the interviews, but there are no examinations in ICMR. Okay, so recruitments for scientific positions, you can definitely go, but you have to check your specific qualifications, experience, and expertise in the relevant field. Number 2 is this is the most suitable position. Okay, suitable thing to go. And the third thing is ICMR recognized institutions. I'll show you how many institutions are associated with ICMR. What are the things you can directly join the institutions for the education, because ICMR recognized institutions are the best options to join ICMR. If you have studied or done some diplomas or some kind of certification courses from ICMR institutions, you will be in the network of ICMR and you will give the preferences. You will get that preferred position first over all the other applicants. Okay, so I'll show you what are there. There are almost 26 ICMR institutions in India. I'll show you all those. Okay, so students can pursue their education at ICMR recognized institutions and universities, offering programs in medical and related sciences. Completing course or research projects in collaboration with ICMR or affiliation institutions can provide valuable exposure. Why ICMR affiliated institutions? To get the valuable exposure and networking opportunities, that increasing the chances clearly that will increase your chances of future engagement with ICMR. Understand? So there are multiple certificate courses, there are degree courses, diploma courses. I'll show you all the institutions. Okay, list of institutions. Then internship and training programs with ICMR. There are multiple internship and training programs. I'll show you. There are conferences, multiple things. If you are joined with ICMR and if you are writing in CV that you have done something with ICMR, you will be definitely preferred. Okay, you will be definitely preferred. So ICMR offers internships and training programs for students and researchers to gain the practical experience in medical and research settings. These programs provide exposure to various research areas, methodologies, and facilities within ICMR. Okay, then collaborative research projects, wonderful thing, as you can join as CRC, you can join as research assistant in any institution. ICMR funded projects are there like AIMS or PGMR Chandigarh or PGCI
PGRI, this Puducherry, Bhubaneswar, Bhopal, Delhi. There are lot of projects everywhere you can get in all the pharmacy colleges, on the medical colleges, and you'll be seeing a lot of advertisements from different projects, and they will be looking for research assistants, research associates. So if you get associated with ICMR project, after some experience, you can directly get into ICMR positions. And ICMR positions does not mean that they will be calling you to the ICMR headquarters. There are positions in ICMR headquarters as well. A lot of my friends after PharmD, they are working with ICMR. You won't believe they are working with ICMR in ICMR headquarters, Delhi. ICMR headquarters are in AIMS, Delhi, actually. In the part of AIMS, Delhi. I mean the campus, but they are working in the ICMR. Okay. So a student can participate in collaborative research projects between their educational institutions. Between your educational institution, if somebody is having the research projects funded by ICMR, these collaborations allow students to gain hands-on research experience, work closely with ICMR researchers, and contribute to ongoing research initiatives. Contribute to ongoing research initiatives. You will get the lot of knowledge. Okay. So this is how we can join the ICMR. Students can join the ICMR. Now I'll take you to the website of ICMR, and before that, let me tell you what is the website. It is essential for the students. Remember this: regularly check the official ICMR website. Regularly check the official ICMR website, that is www.icmr.gov.in, for updates, announcements, and specific application guidelines for all the fellowships, job vacancies, and other programs. Right, guys? So that's how you can get into ICMR. That's how you can join the ICMR. I'll take you now to the ICMR website. But before that, let me tell you about, as I told you, let me tell you a little about CleanMed. So CleanMed, we had started as a CRO in 2019. And later we have expanded into research services and educational services. So research services, we have CRO, like project management, data management, and all. Research consultations like study and protocol design, grant proposals, statistical analysis, everything. Medical writing, research thesis writing, scientific papers, research reports, we help in all that. Okay, and in educational services, we have collaboration with around 150 pharmacy and medical colleges and universities in India right now. And we have trained 25,000 plus students in different domains. And from 24 countries, we have right now 100 plus courses and trainings ongoing. That is our USP, that we don't have all the courses continuing, but we have conducted almost 100 plus courses, and we are getting a lot of things. Lot of courses are ongoing, and all the courses are live, right? We have a lot of FDP, short-term, long-term courses, and we have 200 plus experienced faculties on board. Okay, so that's about CleanMed. And you know that tomorrow is this webinar. So a little advertisement for us as well. So tomorrow, if you have not joined Artificial Intelligence in Clinical Research and Medical Writing, join this webinar. This is the the scenario changing webinar going to happen tomorrow. Okay, if you have not joined yet, please join it. Okay, I request all of you to join it. So there are certain seats. I think there are 20 or 30 seats remaining. I was just asking my team. So if you have not joined yet, please join it. Okay. And then recently we have launched these courses, 2 courses. One, starting from 11th of the June, this course, the 4-week online basic certificate course in regulatory affairs and clinical monitoring, audits and inspection in clinical trials. So if you want to join through our LinkedIn profile. You can see the details. You can see the details in our Instagram. You can see the details in our WhatsApp groups. And then we have launched a specific course in 4-month certificate course in research methodology, biostatistics, and SPSS. Okay, that is usually for PharmDs, completely dedicated for PharmDs. The syllabus, research methodology, basics of biostatistics, data graphics, hypothesis testing, statistical method in epidemiology. So you can join this. Okay, so with that, thank you for the patient listening. These are our contact details if you want any kind of information. And let me take you to the website, guys. Okay, let me take you to the website now. Okay, so let me open this. Okay, so just let me know if you can see the. One sec, I'll close this. Okay, so let me know when you can see the browser. Okay, Google Chrome. Can you see the Google Chrome, guys? Please tell me if you can see the Google Chrome here. Can you see the Google Chrome, everyone? Okay, great. So what I'll type here, what I said ICMR, Indian Council of Medical Research .gov.in. Okay, this is the ICMR website, icmr.gov.in. Okay, icmr.gov.in. This is the official website, and it looks like this. It is opening right now. Okay, so yes, this is Bharatiya Ayurvigyan Anusandhan Parishad, Indian Council of Medical Research. Okay, Indian Council of Medical Research. Dr. Rajiv Bahel is right now Secretary to Government of India and handling the Department of Health Research and Director General for ICMR. He is the Director General of ICMR right now, Dr. Rajiv Bahel. Okay, Dr. Rajiv Bahel is the Director for ICMR, and you can see this is the main website. Okay, this is the main website of ICMR. As you can see, there is a home, about us. If you look at the about us, ICMR and thirst areas. So let me show you what are the thirst areas. As I told you, what are the areas of ICMR where you can pursue your research, being a PharmD or being a medical graduate or being a BPharm graduate or being a health science graduate. These are the thirst areas. Look at this. Communicable diseases, all communicable diseases. See, look at this. You can just go and check later. Okay, thirst areas. First is communicable diseases. All type of communicable diseases. Reproductive and child health, nutrition, and non-communicable diseases. Look at the non-communicable diseases: acute myeloid leukemia, virtual autopsy, young diabetes, inflammatory bowel disease, pancreatic disorders, hypertension, heart failure, cardiac myopathy. Proposed, see, you can see here what are ongoing research. In ongoing cardiac research, hypertension is ongoing, myocardial infarction is ongoing, heart failure is ongoing, cardiac rehabilitation ongoing. And see, these are the new things which are proposed by ICMR, and there are wonderful opportunities for applying or to apply for the funds in these areas. District level integrated NCD observatory, ExoMars, miRNA as biomarker, health economics, clinical trials, myocardial infarction in young adults. These are the upcoming thirst areas. These are the proposed thirst areas. In neurological, what are the thirst areas? What are proposed? In oncology, ongoing, proposed. Endocrinology, ongoing, proposed. Oral health, proposed. As people were asking from the dentistry, I can see someone is from dentistry as well. Please make public health pharmacist by ongoing 1-year residential PG called midterm professional doctor. I don't know what's that. Okay, so I have some dentists also in this webinar. So you can go for, see, gastroenterology, snake bite, nephrology, urology, muscular dystrophy, mental health, gastric medicine. I mean, all the medicine. See, environmental medicine, environment, climate change, pulmonary medicine, disability, rehabilitation, ophthalmology, trauma, injuries, emergency medicine. Lot of things are there, guys. Lot of things for you. Okay, you just have to go through and find out what is your thirst area. And then basic medical sciences, traditional medicines, tribal health. Lot of thirst areas are there where ICMR is conducting the research. Okay, now next thing, before I go to the jobs, I'll show you what are the ICMR institutions. Okay, what are the ICMR institutions? If you go to this, I'll go to home and then I'll show you. Okay, let me go to home. I'll show you what are the institutions of ICMR. Yes, see, look at this. Institutes of ICMR. Can you see this? ICMR National Institute of Research in Tribal Health, Jabalpur. ICMR Center for Aging and Mental Health, Kolkata, CAMH. ICMR National Animal Resource Facility for Biomedical Research, Hyderabad. ICMR National Institute of, so for different domains, you have different institutions. If you are interested in any kind of research, you can join these ICMR institutions for the higher education, like certificates, like for some degree courses, some diploma courses, some certifications. You can join these. Like for implementation research and non-communicable disease, Jodhpur, we have ICMR National Institute of Implementation Research on Non-Communicable Diseases. ICMR National Institute of Research in Tuberculosis, Chennai, NIRT. ICMR National Institute of Epidemiology, Chennai. You can see ICMR Bhopal Memorial Hospital and Research Center, BMHRC Bhopal. ICMR Headquarters, New Delhi. We have ICMR National AIDS Research Institute in Pune, NARI. We call it NARI, National AIDS Research Institute. NARI is in Pune. We have ICMR Center for Disease Informatics and Research, NCDIR, Bangalore. NCDIR is in Bangalore. We have ICMR National Institute of Research in Environmental Health in Bhopal. We have ICMR Institute of Health Research in Reproductive and Child Health, NIRCH in Mumbai. We have ICMR National Institute of Cancer Prevention and Research in Noida. Okay. We have National Institute of Immunohematology in Mumbai. We have all lot of, this is not only this. I'm opening, view all centers. So you ICMR website and you check it out. Okay, guys. So yeah, I'll just show you once what are the institutions. Then I'll go to the jobs. See, there are Agra. Okay, Institute of Leprosy and Myobacterial Disease in Agra. In Belgaum, Nehru Nagar, National Institute of Traditional Medicine. Bangalore, Center of Disease Informatics and Research. We have National Institute of Research in Environment Health in Bhopal. We have Chandrapur, Management Control of Hematoglobinopathies. We have National Institute of Epidemiology, Chennai. We have National Institute of Medical Sciences, Medical Statistics in Delhi. Okay, NIMS. We have Research Center, Medical Research Center, Dibrugarh. We have in Hyderabad. We have in Jabalpur, Kolkata, Madurai again. Entomology. We have Reproductive and Child Health in Mumbai. We have again Medical Science, Patna. We have ICMR Vector Control Research Center in Puducherry. We have ICMR National Institute of Virology, Pune. We have again AIDS Research Center, Nari in Pune. We have ICMR Regional Medical Center in Port Blair. We have ICMR Cancer Prevention Research, Noida. We have Immunohematology, Mumbai. Cholera and enteric diseases in Kolkata. We have Research for Non-Communicable Disease in Jodhpur. We have Institution of Nutrition, ICMR, NIN, everyone knows in Hyderabad, NIN is there. Gorakhpur, there is ICMR Center, Research Center in Gorakhpur. We have Delhi Institute of Malaria Research. We have National Institute of Pathology in Delhi. We have National Institute of Research in Tuberculosis in Chennai. Medical Research Center again in Bhopal and Bhubaneswar. Right? There are a lot of things. In occupational health, we have in Ahmedabad. So you can just explore these things, guys. You can just explore by going to ICMR sites. So do something, add on to your certificate, add on some certificates to your CV, and you can join that. Okay. And now I'll come to that final thing. What I wanted to say, again, go to home page. Okay. Again, go to home page, and then I'll show you what exactly you want to see. The jobs. Okay. So nothing at the home page. First thing, read more. If you go to read more, there are information on COVID-19, information on tuberculosis, proposal submission portal. If you have a proposal, go and submit your proposal here. Surveillance dashboard. Now look at the important thing, what we all are looking for, what we all want to look for. Career opportunities, circulars and forms, career opportunities. I'll just click on the career opportunities. You will see, if I open the career opportunities, look at this. Walk-in interview for various positions. ICMR NIRT Chennai. What are these positions? Just check advertisement. Okay, and application form. There are everywhere advertisement and application form. So if I click on this advertisement, it will open in the next page, and you can see here. See, walk-in written test and interview. So written test and interview on the same day. So this is not the specific written test. You will go there and just for the screening, they will be having one written test and then interview. So this is first, the project assistant, field investigator. Position name is project assistant, field investigator, and name of the project is strengthening the monitor of TB elimination in India, district level sentinel survey, DLSS. Okay, place of posting anywhere in Kerala. So look at everything, read everything, and then show your interest or share your CV. Okay, number of posts only one, and the person should belong to OBC because this is government organization. So you always have to follow the reservation rules. Okay, you always have to follow the reservation rules that not in the favor of, but you have to follow that. Okay. So essential qualification, graduation, clearly written graduation or master's degree in life science. Okay, so graduation in life science from a recognized university with 3 years of work experience from a recognized institution. Either if you have graduation only, you should have 3 years of experience. If you are masters or PharmD, clearly masters or PharmD, not written here, but I'm telling you, if you're PharmD, you can directly share your CV and you can join. Okay, nature of duties, they have written here. Age limit, not more than 30 years. Emoluments is 31,000 per month. Consolidated, no HRA and all. Only 31,000 rupees per month. Initial period for 6 months. Duration of the project is just 6 months. So they will write everything in the project. If it suits you, join it. Okay, so you can just go. So date of walk-in interview is 16th June from 9 a.m. to 10 a.m. reporting time, and go with your CV and directly go ahead with that. Then project technician 1, project technician 2, and then project technician 3, and then project technician 3 level. And then there are multiple jobs here. There are multiple jobs in this. Project technician 2, health assistant, project driver come mechanic. Okay, there are other jobs as well. Multitasker staff. So instruction to fill the form, like come with your CV. If you look at the instructions, just bring your all the documents and CVs and come there. Okay, come there. That is the procedure of joining ICMR. Okay, yes, PharmDs come under life science. You should have the relevant experience. Okay, let's go to another thing. Walk-in test and interview for the position of project scientist medical or project scientist C medical microbiology. Okay, scientist C, but medical and medical microbiology. So the eligibility would be MBBS. I'm very sure for this eligibility would be MBBS, because it is, they have written clearly medical. Okay, so look at this. Project scientist C medical, one postgraduate degree. They have written clearly postgraduate degree, as I told you, MD, MS or DNB after MBBS with 1 year of experience, or MBBS degree with 4 years or 3 years of experience at least. Postgraduate diploma in medical subject with 2 years of experience, and MBBS with 4 years of experience. Okay. And elements is like 64,000 plus HRA 8%. Okay. 6 months, you can see project science C, medical microbiology, qualification, postgraduate diploma in microbiology after MBBS or MBBS with 4 years of experience in microbiology. Okay, work experience, that's why experience is important always. Experience in diagnostic microbacteriology, experience in working with NTAP, basic knowledge of computers. These things are desirable qualifications and desirable experience. Okay, so a lot of things you can see here. Technical assistant, you can see. I'll see some important things for you guys. If I can see, yeah, let's see this. Applications are invited for walk-in interview. Only walk-in interview for the position of project senior research fellow in NIN. I'm not sure if it is for PharmD, but I'll see. Let's see what is the qualification. Walk-in interview for that. One position, project senior research fellow, MSc in life science, MSc biotechnology, MSc in genetics. Okay, because they are looking for desirable experiences, molecular biology experiment expert. Okay, salary is 35,000 plus HRA in NIN Hyderabad. Okay, so you should always, every day, you should come and look for the research projects. So you, okay, let me see some more things. Post of director, Puducherry, director. Okay, a lot of things are there. Let me go to second page. It's something important for you guys. We can see here. Okay, NIN, no, NIN will not help. ICMR, NGIL will not help. I think, let's see this. I'll open 2, 3 and then we'll see. Yeah, vacancy notifications for NIMR we can see. NIMR and National Institute of Medical Research. Here we can see some positions. Online applications, contractual post for NIMR. Again, I'll see NIMR. Okay, 2, 3 things we'll see. Now let's see these 3. Okay, and then we can take the question. See, this is in Hindi and there'll be in English as well. See, you can read if you are in Hindi also, English also. So Manipur, Arunachal Pradesh, project assistant 31,000. Qualification, essential qualification, graduate degree in life science from a recognized university with 3 years of experience, or master's degree in life science. So master's degree in life science means PharmDs can apply here. Okay, PharmDs can apply here. Desirable qualification, you should have the Android phone and driving license. So that is their desirable qualification right now. Okay, you can apply anyways. So there are multiple things you should go and check out if you are, if it is helpful, or if it is you are eligible for that. If you are, okay to go there, definitely you should look into. Okay, and then next position what we opened is here. See, yeah, that's something relevant. Yeah, look at this, guys. Look at this. Research project associate. Research associate 1. Research associate 1. 47,000 plus HRA 27%. That means around 65,000, 62 to 65,000 per month salary. Essential qualification, PhD degree in life science with at least 1 research publication in SCI index journals, or having 3 years of research research teaching and design development experience, or MSc in these MSc, okay, or like PharmD. If you are PharmD with 3 years of experience, you can definitely apply. Okay, PharmD plus 2-3 experience, 3 years of experience in any hospital in relevant field. Don't hesitate. If you are a PharmD, if you are M.Pharm, and you are having that certain, experience in the same field, same relevant field, you can apply. Don't hesitate. Okay, when they will look at your profile, they will call you for sure. I'm very sure. Okay, that's how I did not apply for ICMR. They call me because I have done the desirable work in the field of this field of heart failure or field of registry. So that's why, guys. So this is how you can go and you can check a lot of things from ICMR. So now with that, I'll stop because we have provided a lot of information. Now I'll be open for the questions, guys. Okay, ask your questions. Ask your questions, guys. Okay. Yes, PharmD comes under life science. Can having knowledge of SAS and SPSS help us in getting entry-level positions? Like, of course, important. If you have some 3 or 4 months course or certain certificates, additional value-added courses like, clinical research, project management, SAS, SPSS, it will definitely help you. You can join as data analyst. You can join as data entry operator. And guys, data entry operators or the lower level jobs are not contractual. Okay, one more thing I forgot to tell you. The lowest level jobs like this, assistant, technical staff are not contractual. Those are permanent. Contractual things only comes when these are project related, whether it is scientist A, B, C, D, or whatever, okay, or research associate or anything, you will be in the contractual position. If you are applying for scientist C also, you will be in the contractual position because that is project based. Okay, you will not be permanent. But if you are joining as a research assistant, technical assistant or technical staff, you will be permanent part of ICMR. Okay, that is the best part. Okay, so I'll take some questions from YouTube. Let me go to YouTube, guys. Let me see there what are the questions people are asking, and then you also can ask me the questions. You can open your mic and ask the questions. Sir, can freshers can join ICMR? Yes, definitely. I told you. Yes, and I can see Raghukaran sir is here. He's already research scientist at ICMR and working with ICMR for a longer time. Who is more knowledgeable in computer and literature search? Are PharmDs, if you do your curriculum, if you do your research, if you do your project perfectly, you are the most eligible, guys. Okay, PharmDs, I'm telling you, if you are doing your things perfectly, with 100% dedication, your internship, your projects, your publications, you are the most eligible, guys. Most eligible, guys. Okay. क्लिनिकल ट्रायल्स कौन से फेज में चलते हैं? हम फैमिली स्टूडेंट्स एलिजिबल फॉर किसी भी फेज के लिए एलिजिबल हो यार. Phase 1 तो definitely not because those are animal studies, but phase 2, phase 3, phase 4, all you are eligible. Salary of CRC, as I told you, more than 30,000, more than 30,000 in ICMR. If you're joining ICMR or ICMR project, your salary will be really high. Oh, I think I have answered these questions. Yes. So Raghukar sir has told, he has pointed very nicely here. Public health pharmacist, you can do 1-year residential postgraduate program called midterm professional doctor, and you can definitely join this at PHFI, Public Health Foundation of India. That is also part of Government of India. You can definitely go to Bangalore and join PHFI for this. Sir, can fresher apply for clinical research associate? Yes, absolutely. Can interns apply for joint fellowships now? No. You should have your degree complete in your hand. Don't be in rush, guys. Don't be in rush. Do your research perfectly. When you are intern, you know why they have made the internship in PharmDs? Because you should learn the clinics and you should conduct some research. You should do some good research. You guys are not doing that. That is the main problem. You guys are running away from the research at home. Okay, you guys are running away from the research. That's why there are the problems. If you are placed in some hospital, you should go, you should do some research, short-term program, short-term project, long-term project, do something. You have 1 year, you can conduct 6-month result and 6 months you can publish it. Talk to your doctors, talk to your project manager, project guide, whoever is in the institute. Do that. Okay. See, it is definitely, if you are not able to publish the journal, publish the paper, somehow there are many factors. If you are not able to publish the journal or publish the paper somehow, but you have done the research, you should have that knowledge and you can say, sir, it was rejected multiple times. It is in the communication, but you should have that knowledge of paper submission, paper of writing, literature search, research methodologies. How did you write the paper? How did you write the manuscript? How did you analyze the results? Those everything, the experience will teach you. Experience, whatever experience you have in writing the paper and conducting the research, that experience will help you getting job in ICM. Okay. Suchitra, Ms. Suchitra, if I am able to answer your question, if it is not published with certain problems, with certain consequences, then you must have that. You will have that experience. Now you can tell them that it is communicated. You can write that publication part. It is okay, communicated. Okay, communicated with journal, and then you can explain, sir, I have the entire knowledge, I have done entire things, but due to some reasons, it has not been published yet. To the interviewer. How to get internship in ICMR as PharmD? Just go to the ICMR fellowships. As I told you, there are, let me show you guys. Okay, let me show you the fellowships also. Once more, I'll go to the ICMR site. I'll show you the fellowships also. I think I did not show you. Let me show you the fellowships also. Yes, absolutely. PharmD, MPharm pharmacology graduates are eligible as PharmDs or MPharm pharmacy practice. MPharm pharmacologies are also as eligible as PharmDs and pharmacy practice people in ICMR. Okay, guys. So let me open this and let me share the screen with you. So you can see this. Okay, this is ICMR. Okay, now go to the resource center, courses and trainings. You can see here multiple courses and trainings are there. See, training course on medical genetics from 19th June to 14th July at GCRI Mumbai. Okay, here is the brochure. Let's see the brochure. Okay, then online certificate course on health research fundamentals, Chennai. Then online certificate course in NLCR 102. Ethics reviews for health research at ICMR NI Chennai. You can see all these. See, this is the course at Mumbai from 19th to this, and I think there will be no fees. They usually don't keep the fees. Only 2,000 rupees. Only 2,000 rupees. See, Government of India it is. No, mostly no fees. Okay, you can see this online health informatics job. You will go to the external website. Yes, we are going to the external website, and you can see that job, the fellowship here as well. HRF here, if you see this, health research fundamentals. Okay, prerequisites, course duration, certification exam. This might be free. 100%, I'm very sure this would be free. or maybe 1,000 rupees fees or 500 rupees fees. I think it's free only. Okay, so you can join these online offline courses. Okay, go to the course. NPTEL, definitely it will be all the NPTEL free of course. See, this is free of course or 1,000 rupees. Learners enrolled already, 680 learners enrolled in this. Already 680 learners enrolled in this course. Okay, Health Research Fundamentals by National Institute of Epidemiology. Okay, see, free of cost. You can do this course from NPTEL. Okay. 1,000 rupees fees. The exam is optional for a fees of 1,000 rupees. If you want certificate, you have to give the exam. You have to pay 1,000 rupees at SWAYAM portal. Okay. So these are the courses, and let me show you the fellowships also. Okay, resource centers, fellowships. Where are the fellowships on? Fellowship here. Junior research fellowships, SRA, short-term studentship. Junior research fellowships are here. Okay, in grants, you can see the fellowships as well. What are the fellowships and ongoing? Okay, you can see the grants. What are the grants for MS, PhDs, postdoctoral fellows, ICMR research grant? Everything will be available here. See, computer-based examination for ICMR Junior Fellowship 2030, link 2023, link to apply. Okay, and see ICMR exam candidate live score, computer-based September 23 or 43. These are everywhere. You can just see, go to the grants, go to the fellowships and check all the fellowships, SRF, RAs, junior research fellowships and all. Okay, see entrance exam and everything is there. You just can apply. Start date 20th May and end date 18th June. Closing date for this ICMR JRF entrance examination is 16th or 18th May, 18th June, sorry. Okay, so you can definitely go and check the website, guys. Okay, so with that, I'll take some more questions. If you have, please ask me your questions, guys. Okay. Oh, a lot of questions. Okay, let me take these questions, guys. 1 second. Yes. Let me adjust myself. Okay. Can having knowledge of CES, I told this answer, I think. Then. Sir, is our research only limited to lab analysis or work with patients during PhD in India? No. Surveys are there. Population health studies are there. Public health, community health, smoking, cessation, these pandemics, endemics, non-communicable, communicable. Research is not limited to lab or work with patients. Not at all. You can do any kind of research in India. Okay. Harshil Patil, any kind of research you can do in India. Sir, is our okay. Is CSIR net important for PharmDs to get into PhD? Not at all. No. I think PharmDs are even not allowed here to write CSIR net. They can write as a life science, branch. Definitely they can, but I don't think it's helpful somewhere. How can work as a medical writer in ICMR? Medical writer positions are, there in ICMR definitely, but I'm not very sure. It will come under the technical staff only. It will come under the technical staff. You just have to look into the advertisements of ICMR. Lizane, I think, if I'm not pronouncing your name wrong, Lizane, you can just go to the ICMR website. If there are scientific writers in the technical staff, you can join. By any chance, can we do fellowship in oncotherapeutics? I'm not sure that what areas are available, but you have to look into the advertisement. There are multiple, and yes, you can do the fellowship in oncotherapeutics, I think, from ICMR, but there are certain limitations, because there is the oncotherapeutic ICMR center in Noida. Yes, there is. Is it necessary to publish one or article in a journal, or is obtaining DOI? No. See, obtaining DOI means publication and acceptance. Acceptance is enough. Acceptance in a good journal, acceptance email is enough. But it should be published. If it is accepted, it must be getting DOI. And if it is getting DOI is not something which you will get before publication. Not at all. It will be either restricted, the journal, the paper will be either restricted or open to everyone, but it would be published, then only you will get DOI. It must be accepted by journal. Then only you will get the DOI. Otherwise, you will not get the DOI. What after ICMR JRF exam? Positions, you will get the position ICMR JRF. If you give, you will be eligible to get the scholarship. You will get the JRF scholarships and you will get the position anywhere, wherever you are applying, in the colleges, in the centers of ICMR, or in the projects of ICMR, you will get the job for sure. Okay. Okay, I think YouTube, there are no questions, only one question. Ardra PS, Ardra is having, what are the skills needed the freshers to get into? Research skills, publications, whatever you have done, that SPSS, biostatistics knowledge, research methodologies knowledge, data entry, surveys, that kind of knowledge will help you get into ICMR as a fresher. Okay. See, scientist C is not the campus job here, guys. Scientist B or scientist C is not a campus job. Okay, you will be at any place, at any site, at any hospital, or at any center of ICMR. It is not a campus-based job like you will be going to the ICMR office every day and working there. Okay, this is like you might be somewhere in South India, North India, East India, Central India, Andaman Nicobar, or anywhere. This is the site-based job. This is the project-based job. Scientists C are project-based jobs. Okay, so work environment depends on you. You will be handling the team, so you should be nice, humble, and you will be the boss. If you are a scientist C, you will be the boss of multiple people. Okay, then you will be reporting directly to the ICMR. Okay, and you will be not like only the boss of certain data entry operators or data extractors or data collectors. You will be handling the senior professors, maybe the deans of medical colleges, maybe the professors of medical colleges and pharmacy colleges, not pharmacy colleges definitely, but medical colleges. As a PI, they will be the PI working for ICMR projects, and you will be the in charge of those projects. You have to handle them. Okay, so the work environment, the job definitely would be tough, but you should be humble. Okay, because that is your job. You are representing ICMR and you are collaborator between ICMR and those people. Okay, Rajiv Anand, I think I'm answering to Rajiv Anand right now. So yes, the work environment depends on you, and it's not necessary that it is a campus job or it is the ICMR office job. You may have to handle 10 hospitals, you may have to handle 10 professors, 10 PIs, 5 PIs, 50 PIs, 100 PIs, team of 100 data entry operators, data surveyors, or many people. Finances, you have to handle the finances. ICMR ask for paisas. Okay, if you do some mistakes in the finances, come on, they ask for single paisa also. Where is my single paisa? Where did you spend my single paisa? Okay, so being a scientist C or scientist B, you have to be good in finance, you have to be good in management, you have to be good in research, you have to be good in policies, you have to be good in behavior. Everything counts. Projects are based on hospital, communities, patients, pandemic, endemic, non-communicable, communicable. Depends, yeah, Jones, depends. All type of research projects you will get. Hospital-based, community-based, surveys, every type of job, every type of project are there. How to learn methodology? Join some research methodology course. I think we are also launching a research methodology course. If you want to join, in next 2 days we'll be launching that course. Anyways, we have the research methodologies typing, Oh, syllabus for ICMR JRF exam. Yes, you can get it from the Google. That I'll suggest you can get it from the Google. Okay, let me see some questions in YouTube, and then if you have, I'll take 1 or 2 more questions from Zoom. If you have, guys, please ask your questions now. Sir, if there is study, okay, publish. I think you have done this. How can get internship in the ICMR? Choose your area, then choose the college of ICMR, like which center of ICMR you want, or which project of ICMR you want, and then you can join the internship. But there are certain timings when they open the option. You cannot anytime join the ICMR. That is the problem. ICMR comes with the projects. ICMR comes with their limitations, the timings and all. So you cannot directly anytime join the fellowships or internships. It all based on their requirements. Their whenever they are opening the places, whenever they are opening the vacancies, then only you can join that. Okay. Okay, and yes, any opportunities of M-Pharm pharmacology? M-Pharm pharmacology, people are eligible for everything, whatever eligible, MBBS, PharmDs, M-Pharm pharmacology, M-Pharm pharmacy practice, nursing, MSc nursing, people are also eligible for those things. Okay, guys. So I think I have answers. I have answered all the questions here. How many years of experience will be needed to be a scientist B? See, if you are PharmD, if you are masters, then may not be needing any kind of experience, but being a bachelor, or it is always advisable to work with research and publish at least 2 to 3 papers or 5 papers for scientist B in good index journals, and good knowledge of research fundings, good knowledge of research conduction and handling a team. So that will help you in getting the research scientist B. Okay, so I think that's all with the questions there. No, see, DOI you cannot get from the organizations. DOI will be given by the agencies to the journal only. You cannot get your own DOI. No, if you are publishing a paper in any journal will obtain DOI for that. You cannot directly getting the DOI. DOI will be given to the published papers. DOI is given by the agency, and that agency will give DOI to the journals only. People cannot get the DOI directly for their publications or papers. Understand that? The journals, published journals, will get the DOI number automatically because that organization or the publisher has the contract with the DOI agency. Okay. 4 months course in research methodology and stat will help to learn research methodology. Yeah, definitely, it will help. So every post including JRF is contract based. Yes, all research based jobs are contractual. How to publish the paper? You can contact me later. Right now, there are a lot of things. Research journals, there are research journals websites. There are Scopus. Okay, I'll repeat. Scopus indexed, it must be either or Web of Science or PubMed. PubMed keep last. Can a SQL for data analytics course will help you in research field? Yes, definitely. Okay, guys. So experience of CRA after PharmD is helpful to get a job or ICMR. Okay. So guys, you can just join us in our Instagram, Climate Research Solutions, LinkedIn, and you can subscribe to our channel for more things. Okay, with that, thank you guys for joining. Thank you everyone, and I'll be coming with more of such webinars and informative things for all of you. Thank you very much for joining, guys. Thank you. Okay, just visit the ICMR website and you will get how to join ICMR chair. Okay. Thank you guys. Take care. Have a good night. Take care, everyone. Take care. Bye-bye. See you.